We're looking forward to another exciting evening tonight.
Right.
I think tonight will be that night for this demystifying all myths because we are talking about everything cancer, Q&A. Ladies and gentlemen, karibuni sana. I can see Danny, Violet, Michelle, nice to see you. Joseph, karibu sana. Let's take a few minutes and then we just wait for guys to log in, another 5 or so, and we will be ready to start. Nice to see you, guys. Asanteni sana. Nice to see you. Joseph, karibu sana. Let's take a few minutes and then we just wait for guys to log in, another 5 or so, and we will be ready to start. Nice to see you, guys. Thank you so much for tuning in tonight. It's yet another great and awesome evening that the Lord has done. He's given to us. I don't know how your day has been. Mine has been quite dramatic, I must confess. I was not sure that I'll make it, but by God's grace, I'm here and we're going to have a good time tonight. Ladies and gentlemen, I want you to send your shout outs to the people that you know, the people who you want to see. Like I always say, my name is Mwangi Cheke from Outburst. Nice to see all of you. Dr. Mutuma, karibu sana. Michelle Milulu, nice to see you. Danny, there's someone there, CBV. Awesome, good to see you. My brother from another mother, Gore. Thank you for tuning in tonight. You made it. Gregory Okoth, I can see you. Nice to see you. Susan, Joseph Ndoro. Thank you guys for tuning in. We're going to have a treat, I must confess. Irene Moas, thank you for tuning in and for your support. Maureen Kwamboka. All right, so tonight is going to be a good night. Nice to see all of you. I want to say that this is our grand finale tonight, and after, you know, in a short while we will be listening to our panelists, and we have several. We have only 3, but tonight is that night that we will demystify a lot about the greatest pandemic that is called in this COVID-19 times. It's been tough, it's been rough, but God has been good. All right. So before we go so far, kindly, could you type? Let me see. Let me see what you're grateful tonight about. Let me see. All right. I will also request and gentlemen, I want to request tonight, kindly put on mute. I want to try that tonight at some point, I will give you a chance to also go live. You never know. I might just pick on you. I might give you a chance to go live and ask your question live. But before we do that, I want us to kindly just put on mute. Let's be on mute so that there's no echo, there's no disturbance, so that we can hear each other nice and clear. My name is Mwangi Cheke from Outburst Limited. This is the Candid Conversation coming to you live here, virtually. I don't know where you are. It's also nice to just let me know where you are. I am recording this live from Nakuru, believe you me. Okay, tonight I'm in Nakuru. I'm having a good time. It has been a rough day, but God has been good. I want to send my shout outs to Phoebe. Phoebe, nice to see you. Grace, I can see you tuning in right now. Nice to see all of you. And I want to let you know that we're going to have a good time tonight. I can't wait what we have in store. CBV, you're telling us that I'm grateful for the gift of life and good health. Me too, me too, me too. I told you that, guys, as you do this, you're cheering me on. Milulu Michelle, I'm feeling grateful to be with my mom and siblings after such a long time. So Michelle has taken a break, is uniting with family. Michelle, nice to see your pretty face. Kindly send our shout outs to mom and all your siblings. Sawa, Michelle. Awesome. Susan, you're saying grateful for health, friends, and peace. Wow. Susan, you're a star. Irene, you are grateful for good health and for family, for your family. Amazing, amazing. Katie, good evening. Katie, kindly let us know how you're doing and what you're grateful to God about. Irene Watts is saying she's tuning in on the Southern Bypass. So kindly be careful. Don't put video, only listen and take care, keep safe. Danny, you're also reminding us that we are also live on FB Live. Faith, Faith, this is a Faith from Kisumu Dala, all right? My buddy Faith is grateful for the gift of life and good health. Asante sana Faith. Gora Sola, you're grateful for family, good health, and friends. Asante sana. You guys are just the bomb. Let me tell you, I am so grateful to God. He has been great. He has done great things for me. I am grateful to be alive today. Maureen Kwamboka tonight is grateful for plantains here all the way from Freetown, Sierra Leone. Nakuona sana. All right, ladies and gentlemen, tonight is the grand finale where we will be having a Q&A. We will be asking our questions, posing our questions to Dr. Mutuma. We also will be having our nutritionist, Ngata. I hope she will be logging in a short while. And we'll be having our Anne Wandati, who is a counseling psychologist. So we are waiting for them to log in. And I believe that with these three, we might have questions. Then we will toss the questions to them, and they will be telling us what's up and what's on. Katie Karaoke is saying, I'm grateful to God for the gift of life and good health. Amazing. What are you grateful to God about, or what are you grateful to God for? I am so grateful to God because tonight He has kept me. I am grateful for the gift of life and good health. Let me tell you, it has been a bit dramatic today. My car just broke down, and I have been sweating to just get a place to hang out with you guys. And I am so grateful to God about that. So ladies and gentlemen, this is Candid Conversation, Season 1, episode grand final. This one is the 10th, and this one is the grand final, I'm telling you. And so we're going to have a good time. This is where we will be demystifying all the myths about cancer, about life. Tonight, let's just ask questions. Let's throw in those things that have been disturbing you, and tonight you're gonna get answers. I want to remind you that coming Saturday, this Saturday, the 10th of October, we shall be having our Boot Cancer Challenge, Season 5, and the 5th edition, and it will be our first ever virtual Boot Cancer Challenge. Kindly book a date with us at 8 a.m. all the way to 10:30. Actually, the poster says 11 a.m. Kindly be there. October the 10th, it will be this Saturday. And this is a charitable event. We are supporting Our Lady Hospice, the Gio. And so, ladies and gentlemen, kindly book a date with us. And on this one, attend with your family, with your friends, wherever they will be, whoever they will be, let them come. We want to say a big thank you to our sponsors who have already come on board, and they're right there. Safaricom, we want to give you our shout outs, and we're saying thank you for supporting us. Kenya Palliative and Hospice Association Kenya, KEFCA have been of great support to us. I want to say a big thank you to KEFCA Kenya, Hospice and Palliative Care Association. You guys are amazing. You are awesome. I can't wait to hear Dr. Ali speak on Saturday the 10th. Now, on this virtual Boot Cancer Challenge, we will also be marking the World Hospice and Palliative Care Day. And so on this event, we will be channeling all our support towards the GIO who we are giving towards this year. And the number to give is right there, 750-822. That's our till number. If you want to give towards this cause, the number to use is the till number 750-822. And remember, as you give, you're being a blessing to someone, and your life will never, ever, 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 ever be the same again. I want to send my shout out to Serena Hotel. Serena Hotel are also our sponsors. They have already given a voucher, and they're saying we need to choose a couple who will be going to Sweet Waters for an awesome treat, okay? So if you want to be there, if you want to go to Sweet Waters, you have to be here on Saturday the 10th from 8 to 11. You just never know. I might be just throwing this voucher to you, and you will be having a good time. Grace Wamoirore is saying, I am grateful for joy and peace in my heart despite the threat of reopening school come Monday morning. Let me tell you, Grace, Monday morning it is, and you are already blessed. Okay, so ladies and gentlemen, thank you so much for tuning in. This is our grand finale, episode 10. Ladies and gentlemen, tonight is that night where we are asking questions to whoever, whichever questions that we'll be asking, we are throwing them all the way to our doctor who will be tuning in. He's already here, Dr. Mutuma. We had an awesome time with him last week where we were talking about prostate cancer. And he was amazing. He did a fantastic job. Jerry Totia, asante sana for tuning in. It's gonna be a good night. Joyce Getangu, Miriam, karibuni sana, everyone. Now, the next thing I want you to do, ladies and gentlemen, is could you kindly send at least one question right away. Let me see you type one question that you have been having, and you would be grateful if it is answered tonight. What is your question tonight? What is your question? What is your question? Kindly type your question. If you have a question, I know all of you guys have a question. One question that has been on your mind throughout this season, or even just in your life, and you're wondering, who would I be sending this? Who can I ask this question? Tonight is that night. I need you to ask that question. We have a panelist of 3. We have a doctor. And the doctor is a pathologist. He knows everything cancer, and so he will be able to answer that. We have number 2, a nutritionist. And number 3, we have a counseling psychologist. So kindly type your questions, and we will be answering your questions. Dr. Mutuma, how are you doing tonight? Daktari, how are you doing tonight?
I'm doing well. Are you hearing me?
Yes, now I can.
All right, I'm doing very well. Yes.
Oh, great. Now, Daktari, one of the things that was a highlight last week, and I've been talking to many men, you know, they were worried and they were asking, you know, for a long time they thought that prostrate was number one, it would affect their sex life, and that's why they don't shout too loud about it, whether they have it or one of their member of the family. And two, many people are shocked that that when you said when you talked about prostrate being, you know, brought about by a lot of testosterone instead, and many people thought it was maybe perhaps due to lack of enough sex. I'm shocked. Dr. could you kindly enlighten us once more about that as we wait for questions?
Right. I think about the prostate, what I said is that prostate is the gland which is found mainly in men. And as I said, that it has minimal actually effect when it comes to sexual functions of a man. Without having a prostate not affect at all your fertility, and then you'll be able to live a normal life. So prostate is actually not a major organ per se. And that's why prostate, as I said, is the only organ which grows big with age. So when you are young, the prostate is normally very, very, very small. And by the time you are 50 years, 60 years, it has actually grown to be very almost 100 times. So it grows with time. And that's why you find that actually prostate mainly, it starts giving people problems from the age of 50, 55 years. By the time somebody is 70 and 80, actually it is a problem. That's why you find that it's only men who are of age, that is around 50 and 60s and 70s, actually who have got high rates of cancer of the prostate. And that's why you find that, as I've said, is that as you keep on growing older and older, you find that actually you have a problem of passing urine, and the urine does not go very far because the prostate presses where the urine passes. And that's why actually most men actually have a problem of passing urine, and sometimes the urine actually blocks completely so that a man cannot pass urine at all without being put a catheter or getting some other methods to be able to get the urine out. So prostate is a major problem, and I've said is that cancer of the prostate is commonest in men, and I've said that in Kenya we are saying that in every 8 men, 1 man has got a chance of actually having cancer of the prostate. So it's quite common cancer, and it's not common only in Kenya. All over the world, in men, cancer of the prostate is common as cancer.
Awesome. Asante sana daktari. I want to pose a question to you in a short while, and this is on cervical cancer, because you know it's like the extreme opposite. Okay, but before I do that, Michelle wants to is saying, I don't have a question per se, sorry, but a big thank you to Dr. Mutuma. My husband has stopped taking white chapati and sugar. He has changed his diet, all right? So last week, Daktari, it was amazing. I think you burst so many people's bubbles when you said, you talked about sugar, about milk, and about white chapati and things like that. I am trying, I won't lie. I am reducing my sugar day by day, and I will catch up. Ndufia and without milk, okay? I want also to request all of us to kindly share the Facebook Live, okay? So that the world can get to know about Candid Conversation, because we are learning a lot. We are gaining from these experts, and we don't want to leave anyone behind. So if you can do that, share the Facebook Live on your wall, and it's gonna be great. I also would wish that you invite someone, even right now. Just say, my brother or my sister from another mother, kindly join us on Candid Conversation, and you will benefit. In a short while, we will also be sharing with you the poster for Saturday, the 10th of October, where we'll be marking and celebrating the World Palliative Day, and we will be having our Boot Cancer Challenge. And I would also request for your help, good people. Kindly tell it to your friends, to your family, to your colleagues at work, you know, to your neighbor, even tell your enemy, because you would not want them to get caught up, and then we are still the ones to help. So we are trying to do whatever we can to just make sure that we'll help as many people as possible. I also want to remind you that if perhaps you have missed any episode of Candid Conversation, you can catch it on YouTube after every episode. The recorded version is put on our YouTube channel, which is Outburst Limited. So kindly go there, or you can refer someone to go there, and they will be it will be of great help to them. Ladies and gentlemen, I want to appreciate our sponsors who have been with us and are still holding fort with us. K&W Limited, I know tonight Nkatha will be here tonight, and even before she does that, I want to say asante Nkatha for being a blessing to us and showing us what to eat and how to eat right. I want to also just send my shout outs to East Africa School of Psychology, who have been giving us all these great guys to talk up to us on mental health and things like that. Serena Hotels, asanteni sana for supporting us. Loreto Convent Msongari, time and again, they have attended our Boot Cancer Challenge, and I believe that this year it will be a little different, but they will also be there virtually. Safaricom, we salute you. You are amazing. The Zambezi Hospital, you know, represented a lot here by Dr. Mutuma. I want to say asante sana. Before I continue, Daktari, someone is saying, could the doctor elucidate more on masturbation and prostate cancer, Daktari?
Right. I think masturbation has no any effect on the prostate cancer. Only that is, of course, as I've said, the more active the man is, the higher the chance of having cancer of the prostate. But I think the age where masturbation is very common, actually, they're not affected by cancers. Because, of course, I don't expect masturbation in a man over 50 or 60 years. But I think for the young age, I think it's not affected, and it has not any effect at all.
Awesome, awesome. Ladies and gentlemen, kindly let's take time and type out our questions, okay? And if you want to go live like me tonight, kindly raise your hand. I might just pick you so that you can hear your voice and you can ask your question. But let me say asante sana Rachel Nyox for attending tonight's session. Thank you, Phoebe, you're a star. Lucy Favor, I can see you. Susan, asante sana. Julie M, you are amazing. Faith, thank you for tuning in. Kindly, ladies and gentlemen, let's put our panelists, so to say, to task, because that's why they came tonight. They want to answer as many questions as are asked. And so I want to request all of us to kindly type your question or raise your hand. Tonight is that night. I might just call you for us to hear your voice. Could we take a minute or so to just send your questions on whatever on whatever area? It could be prostate, it could be cervical cancer, it could be mental health, it could be about your diet, whatever it is. Kindly ask, okay? Ask. That's why we are here tonight. This is the grand finale for season 1 of Candid Conversation. And after this, we'll crown it on Saturday with the Boot Cancer Challenge happening from 8 to 11 a.m. Here virtually. Wherever you will be, just tune in. We'll be having a few of the workouts. We'll have a few panelists to talk about different topics, and we will have a good time, I can promise, okay? So kindly book a date with us. Tell your friend, tell your neighbor, tell your family, tell your enemy, whoever it is, just go out there and talk to them. Let me pose this question to Daktari. My question is on prostate cancer. When the prostate becomes so big, it blocks the passing of urine. Why can't it just be surgically removed and to eliminate that problem once and for all, Doctor?
Right. I think the enlargement of the prostate is called benign prostatic hypertrophy. That's the benign, the prostate becomes so big, but it's basically benign, it has no effect. I think before there was, people used to be operated when they removed the prostate, we call it prostatectomy. So most of people are used to be removed prostatectomy where the prostate is very big. But nowadays, most of the doctors, they don't prefer to do or to remove the prostate. What they do, they can give you a drug which will reduce the size of the prostate, and that is actually okay, because what we have is that the prostate has become very big, and if you can be given the drug and the prostate becomes small and the blockage of the urine is not there, that becomes good. And also the other method which is used is not really operations, that you remove the part of the prostate which is actually blocking the urethra where the urine passes, and that is TURP. There is an operation called TURP. That is just removal of the prostate along the urethra, so that the urethra actually becomes open. Because what happens is that actually the prostate, when it becomes big, it normally blocks the prostate. And normally when the prostate is blocked, the prostate is very big, and the urethra is blocked, you cannot be able to pass urine. And that's why instead of putting the catheter out, instead of the operation nowadays, there's a drug which can be given, and the prostate becomes small and start passing urine, or it can be removed by using this procedure. We call it TURP, so that you can be able to pass urine normally. Because when the prostate is enlarged and it's just benign, there's no need of worrying very much, because it's not cancerous, it's just become big, and the only thing you want is actually to be able to pass urine well. And that's actually the procedure which is done to people who have a problem of passing urine. Remember, enlargement of the prostate or a benign prostatic hypertrophy, BPH, benign prostatic hypertrophy, BPH. It is not cancerous, so you don't need to worry. And a patient like that, the only issue you are worried about is passing urine. And if you can be made to pass urine, you have no issue. Remember, there's a big difference between benign prostatic hypertrophy, that is BPH, and cancer of the prostate. Those are not connected, because when it's benign, there's no cancer. But remember, prostate can have cancer when it's not enlarged. So enlargement and cancer are not related at all. So you can have benign prostatic hypertrophy and you have no cancer at all. So the passing of the urine, or issues of passing of the urine, is not related at all with the cancer of the prostate. You can have cancer of the prostate and you are passing urine well. So all the same, passing of the urine or having issues of passing of the urine, although the cancer can cause a problem of passing of the urine, but in most cases, it's mainly caused by benign prostatic hypertrophy. And that, I've said, can be removed by doing prostatectomy, that is removing the prostate, which is not be done very common nowadays. You can have the drug which you are given, or you can have a minor procedure which is done, and you can be able to pass urine well.
Awesome. And I also remember that, Daktari, you say that the worst problem about cancer is it is not painful, all right? And that's where many people get it wrong, because we wait until we are in pain to go to the hospital. And that's, by the time we are in pain, we are already in trouble. Isn't that right?
Yes, that's right. In most cases, actually, not most cases, all the time cancer is not painful. So stage 1, 2, and 3, no pain. Pain comes in stage 4, especially when the cancer has moved or the cancer has become very big. It has started to cause other problems around where it is, or around the tissue, or it has moved to another part of the body, and it's causing compression, or actually is causing a distortion of part of the body, and that's actually when you can have the symptoms. But basically, cancer is not painful at all.
Awesome. Dr. Many people have also talked about detox. It has been, it has become a big word when we're talking nutrition. And I'd want, as someone is saying, which is the best way to detox your body? And I think it would be great if we are able to just highlight this. Someone else is saying, could Daktari take us through detoxification, Daktari?
Right. I think detoxification is a major thing nowadays because, as you know very well, and everybody knows that the environment we are living now is very polluted, and that pollution and the food which we take and with the food which we consume, it has a lot of chemicals and it has a lot of pollutions, and that's actually what is causing the major problem in our bodies, because our bodies has got a lot of toxins. And detox is actually removing the toxins from the body. Detoxification naturally is done by the liver. That's most of the toxins are removed from the body through the liver and also through the kidney. Through the liver, they're normally removed in the gallbladder and moved into the intestine and moved by passing stool. And also the other way to detox is actually to be able to pass urine when the toxins passes through the kidney and to the urine. So detoxification, we have got two organs which are very important. That's the liver and the kidney. The third organ which is very important for detoxification is the skin, especially when you sweat. The sweat actually comes out as a toxin, and that's why we normally encourage people to do exercise, and so that can be able to sweat, because when you sweat, there's removal of the toxins there. Now, I think let me touch a bit about where we get the toxins so that people can understand and everybody can know that everybody has got toxins. You know, there's a tendency to feel that actually me, I don't have toxins because I eat well. But let us take, for example, I would like to use the food which is good. I'll not use chapati because it's that toxins. I'll not use bread because that's so toxic. But let me use milk as for example. The milk which everybody takes and to see how can be able to have toxins in our body. Remember, the milk which you are taking nowadays is not the milk where you have your cow which is in the shrubs or in the bush and feeding on grass. Most of the milk, not most, nearly all the milk we take is from dairy cows. And then we start from the dairy cow itself. First is exotic cow. It is not original cow. So the cow has been genetically modified, the cow itself. And then that cow, which we are taking that milk from, that cow is not grazing freely in the land. It is already gauged. It's called zero grazing, where the grass which the cow takes is already a grass grown using fertilizer. It's a grass which has been modified, and then this cow is always ejected, is given antibiotics, is given other drugs, pesticides to kill the ticks and the rest. So you find that this cow, which actually we are taking the milk, we always say that's very good for nutrition, but the milk itself, it has got a lot of toxins because of all this, what has changed over the time. The other example which can give is actually the cabbage in the sukuma wiki, which we always take. We know that this sukuma wiki which we are taking nowadays is good vegetables, green vegetables. We normally advise them, but advise people to take it. But then this sukuma wiki, it has been grown using a fertilizer. It has been sprayed several times using chemicals to kill and other pesticides. And that's those chemicals, they go inside the sukuma wiki. So once we're taking the sukuma wiki, we already have the chemicals. So basically, we have got a lot of chemicals, and more so when we live in the city. And like today, I came with a lot of jam. All that smoke coming from the cars and then from the factories, you breathe it in and it goes to the lungs, and that's why we have all these toxins. So the first and the most important thing why we have cancer very common is increase of toxins in our food chain, increase of toxins in our environment. And we know that those toxins, when they're in the body, actually they go to the cell and normally they cause the gene to mutate. And that mutation of the gene, that's where the cancer starts. So what is the best way to detoxify? What is detoxification? And I would like to go to details a bit about detoxification. First thing, the best detoxifier is water. The way we use the water to wash our clothes and wash our body, the same way it washes our cells. So you need to take a lot of water. Remember, when you take a lot of water, you pass a lot of urine. It means that actually your body is being detoxified. So the first and the most important detoxifier which you must use is water. How to take water? The first thing is that you don't take out of water at once. You need to keep on sipping water throughout, and you don't take water because you are thirsty, and you just take water throughout. And that's why normally, especially this time when it's too hot, it's good to have water, and you take water. And we normally recommend 2 liters of water per day, and that's people saying in Nairobi. In Mombasa, in Kisumu, we recommend almost 4 liters or 5 liters per day because of the sweating and all that. So water is a very good detoxifier. The other food which is very good detoxifier is fruits. Remember, these fruits are detoxifiers and vegetables are detoxifiers, but the same fruits and vegetables already have toxins. And that's why, in most cases, I think for those who are interested to know the best fruits and what I call detoxifying juice, I can be able to send you a write-up of the juices of what you need to do to detoxify naturally. And by naturally, actually, you need to take what we call a soup, or mixture of a soup of sukuma wiki or any green, a mixture of avocado, a mixture of spinach and lemon, and that's when you blend them and you take that, that's a very good detoxifier because it removes all the toxins from your body, and that's natural. Now, there are some supplements which I think I've talked them last time, which are used for detoxification, and there are so many of them. I can't go to all the supplements you're using for detoxification, but mainly the one which I normally recommend, and I recommend to everybody, the best supplement or the best juice you can take to detoxify, it is actually aloe vera. Aloe vera is a plant which can be used for a long time and it's very good for detoxification. The other supplement or the other thing we can take for supplement is called fiber. There are so many companies which make a drug called fiber drugs. And those fiber, remember, fiber is very good because it actually absorbs the toxins from the intestine and clears it quite fast. So fiber is normally very good. And other vitamins like vitamin C, normally very good for detoxification, and also omega-3, what we call the fish oils, are also very, very important. So these are the basic which you need to do for detoxification, and I can be able to send a document for people about detoxification. What you need to do, the most important thing is, remember, is water, and then the fruits and the vegetables, and then you can go for the detoxification. There's a program we normally call Clean 9, and I think this is known by most of the people actually who are in network marketing. Clean 9 is actually a detoxifying program which takes 9 days, very aggressive. Once you take within nine days, there are several exercises, there are several things you're supposed to do, there are several products which you're supposed to take, and I've mentioned about them. So if you take Clean 9 or detoxify program for 9 days, the toxins actually remove, get gotten ready of your body. We normally recommend everybody to be able to detoxify almost once in a year, and that's actually is basically active. That's the active detoxification. Now, there's this method of detoxification which people have used, but I don't normally recommend it. Is actually using enema. That's putting enema in the colon, and then you clean your colon. Remember, most of the toxins are in the colon, so anything which clears your colon is a very good. But there's enemas which are normally given nowadays. They're given a name which I can't remember now. And remember, that is not a good method of detoxification. The best way of detoxification is actually using a natural product to be able to detoxify yourself. So that's actually basically what you need to do to be able to do detoxification.
All right, Daktari, I'm so glad you're talking about water being the greatest, the best detoxifier, and I'm enjoying my big bottle of water right here. Someone is asking about, someone is saying, actually it's called Gregory. Gregory is saying, foods that are high in vitamin B17, are they an effective and natural method of preventing cancer-causing cells from growing? Or does availability of this vitamin kill the cancer cells?
Yeah, there's a lot talked about vitamin B17, which I'm not aware, and I would not approve it very much, because there's more of it's more of myth than it's more fiction than facts, and that's why vitamin B17 is actually, it's a new thing which has come, and it has not been proved to have a lot of effect on when you talk about cancer prevention and also killing cancer cells. And remember, sometimes when somebody says that there is a natural product which can kill cancer cells, I'm really suspicious, because I know the way cancer cells are, And remember, by the time you kill other cells, you expect to kill other normal cells. So the only way I can be able to advise our collaborators today is one, that the best way to do is to prevent cancer. When it comes to treatment of cancer, you need to have active treatment of cancer. That's by surgery, by radiotherapy, or by chemotherapy. The other ways can reduce the growth of cancer or stop the cancer from growing. But most cases, it's normally very difficult to find a natural product which will kill cancer cells actively. And because cancer cells are not very easy to be killed. And remember, cancer cells are normal cells, are abnormal cells in the body, and they are almost like the other normal cells. And that's why you find that when you are treating the cancer itself, the cancer cells themselves, you have also to kill other normal cells in the process. I normally like to have analogy of a treatment of cancer, like when you have a snake inside eggs. The cancer is the snake, and the snake is inside eggs. To be able to kill that snake in the eggs, you have to kill some few eggs, and that's why cancer is. When you are killing the cancer itself, you have to kill some other normal cells, and that's why you find that actually treatment of cancer, it has got so many complications, and the major complications is actually the killing of other cells during that treatment of cancer. And that's why when you talk about B17, and be able to kill some cancer cells, I don't approve that. And up to this time, I don't have any convincing literature which actually I can quote, or any meaningful research which I can quote, which has shown that actually that B17 can be able to kill the cancer cells. And then more so, up to this time, we don't know which fruits or which organs or which plants were for that B17. But basically, that's something which we may need to talk about very much in the future.
Okay, so not too much information known about B17, my brother. So let's work with what we have. Daktari, someone, Faith from Mombasa is asking, how many liters of water should she be taking per day? And then she's also asking, how many times should we do pap smear?
Okay, let me start with the water. Water, we normally recommend maybe 2 liters in Nairobi. Nairobi is not very hot, but Mombasa and Kisumu, we normally recommend 3 or 4 liters per day. And I'm sure people who stay in Mombasa, they know this. And that's often that in Nairobi, we may walk without water, but in Mombasa, we cannot walk without water because it's so humid and you sweat a lot and you lose a lot of water. And that's why you find that actually it's always good to be able to take water throughout. And what I've said, it's not good to take water when you're thirsty. When you take water because you're thirsty, that's not very good, because it means that actually your body is demanding for water. You should be able to take water routinely, and you should be able to sip water actually, and be able to finish at least 8 glasses or at least 2 liters, especially in Nairobi when it's hot as this. Right. The next question is on pap smear. This is a question which I've asked several times. And first thing is to say that actually pap smear is a test which has not been taken serious by women in Kenya. And that's why we find that cancer of the cervix is still a very, very common cancer in Africa, and more so in Kenya, and more so in Nairobi, and in most of the counties. And the cancer of the cervix is most very common, and these are found recently. It's very common in Kilifi, common in Kwale, Mombasa, parts of Machakos County, parts of Kitui County, and parts of Makuene County. In Central Province, Nyeri County, not very common, but we have got some pockets where cancer of the cervix is common. And that's why you find that is normally very, very important. The only way you can be able to screen for cancer of the cervix is by doing pap smear, which is actually taking some few cells from the cervix and looking at them under the microscope. And that's why I've said that most of the women have not actually embraced doing pap smear. Normally, I recommend pap smear between 18 years and 50 years, you do every 2 years. Between 18 years to 50 years, you do every 2 years. And then between 50 years to 75 years, you do after every 4 years. It means that cancer of the cervix is more common in young age than in old age. And when you do it every 2 years before 50 years, after 50 years, every 4 years, and then after 75 years, there's no need of doing pap smear because you can have cancer of the cervix. But remember, cancer of the cervix takes 10 years to develop. And that's very important to, for us to know. And that's why most of the developed countries, many in Europe and also in US, they normally do pap smear to all the women. And of course, it's done for free. And every woman has to go to be done pap smear every year. That's why you cannot find a woman with cancer of the cervix in Europe and also in US, because pap smear is mandatory and it's normally done for free. And that's why we normally say that it's normally very important to make sure that at least every woman is done a pap smear after every 2 years or after every 4 years, depending on the age. And that's why I've said that cancer of the cervix takes 10 years to develop. So it means that when you have been done pap smear and you don't have cancer of the cervix, it means that for the next 10 years, you will be safe for the next 10 years. So that's why in Kenya, I recommend every woman at least to be done pap smear once in a lifetime, because most of women have never been done pap smear at all. And that's why it's very important to do your pap smear and confirm how your cervix is, because without pap smear, you cannot know if your cervix is normal or is not normal. And as I've said about the cancer of the cervix, is that all the women who have cancer of the cervix, and we have got a lot of women, especially even in Zambia, also now we have got patients with cancer of the cervix, they always come stage 4. And cancer of the cervix is actually a very aggressive tumor, and that's why when women can come with stage 4, of course, what I can tell women and everybody is that it does not matter which stage of cancer you are in. Treatment of cancer can be attained irrespective of the stage. But remember, in stage 4, the cure rates are normally minimal. And that's why I normally tell people that once you follow what the doctor says and about the cycles and chemotherapy and radiotherapy and also the surgery, you'll be able to be cured. But pap smear is normally very important, and that's why most women should make sure that at least they're done pap smear within a given time. And I know pap smear is a bit uncomfortable, but it's not that uncomfortable. But of course, it's good for women to be done pap smear every 2 years before 50 years. After 50 years, every 4 years. After 75 years, there's no need of being done pap smear. Right.
Awesome, Daktari. Asante sana. So that is to say, ladies in this forum tonight, if you have not taken a pap smear, it's about that time, all right? It's about that time. One of the things we're trying to do here at Candid Conversation and in our Boot Cancer Challenge is to create awareness. All right, and we are saying you eat right, you exercise, you go for cancer screening, you keep hope alive, you stay healthy. That is what we are championing for. And so, Daktari, Greg is saying, then what is the prevention strategy for cancer? And he's asking detox, and I think you have tried to mention some. Like you have already tackled cervical cancer, but just in a nutshell, could you kindly just tell Greg and others what is the best prevention strategy in a nutshell?
For cancer control, the best strategy is knowledge. It's knowledge, is the attitude, is the practice. You need to have the knowledge. You need to have the right attitude and the right practice. Because unless you mix those three, even if you have the knowledge, you don't practice it, it has no value. And the attitude, how do you approach it? And that's why you find that in Kenya, cancer is a problem because we don't have the knowledge, or the knowledge is very minimal, or the knowledge is given the wrong way. The attitude against screening for us is not that good, and the practice for the screening itself is not good. Now, what is the knowledge about? The knowledge is on the risk factors of cancers. Remember, there's no cause of cancer. What we have is risk factor, and these risk factors have become so common in the community. So when you look at a population of Kenya, we find that the risk factors are so common and so real. So we expect Kenyans to have more cancers, and to have more cancers now, and we will have more cancers in the future because of risk factors. And the best way to control the cancer in Kenya or individual at the family level is that look at your diet. The first thing, and I talked about diet. Look at your diet. You look at your diet every day and emphasize on the diet and on the diet. The second thing about control of cancer is actually to manage your weight. I don't normally say that you lose your weight and you manage your weight so that you're not overweight, you're not obese. And then you do a lot of exercise so that you remove the toxins from the body by doing exercise. And then you don't smoke, you don't take alcohol, because smoking and alcohol are all risk factors of cancers. And then for women, especially for cancer of the endometrium and cancer of the breast, and the cancer of the ovary, you don't take a lot of hormones. And this, I'm talking about contraceptives. Cancer of the breast and cancer of the endometrium become so common because people are taking a lot of hormones. And those are the few of the risk factors. Risk factor, and also, and the knowledge, what you need to know, and this is almost in every family. If your family has got history of cancer, it's good to be screened more common. And that's why we say that cancer is genetic. And that's why it's good to be screened, especially when you've got cancer of the prostate in your family, cancer of the breast in your family. It's always good to be screened. More so, and what's very important, control of cancer. Remember, most cancers are idiopathic. They come without any risk factors. And that's why we normally say that, or we can talk about risk factors, but no, cancer is a disease which it's mysterious because it can get anybody and anytime. And some cancers have no risk factors. So the way to control cancer is the knowledge, is the attitude, is the practice. And mainly when it comes to the practice is actually the screening. Go for cancer screening as frequently as possible. Because once you go for the screening, you'll be able to discover if the cancer, you'll be able to discover before the cancer comes. But remember also, very important, there are some cancers which are not screenable, like cancer of the brain is not screenable. Cancer of esophagus is not that much screenable. There are so many cancers which can be able to screen. But for screenable cancers, it's always good to go for screening because that will make a difference when you know you have cancer and you know it early before it has signs and symptoms. Because the only way you can discover cancer without signs and symptoms, it is only when you go for screening. And that's what we say the best way of cancer control: awareness, screening, early detection, and early treatment. Awareness, that's knowledge, practice, and attitude. Awesome. Screening, and then early diagnosis, early treatment. Asante sana.
Asante sana daktari. You know knowledge, and that's what we do here at Candid Conversation. It's all about knowledge. We come in with a student's heart, which we wear, and we ask the experts to just enlighten us. And we are saying at Candid Conversation is where you are enlightened, you are educated, you are inspired, and that's exactly what we want to do. I like the fact that it's early detection. So we go for cancer screening and early treatment. That is if and in the unfortunate bit that you have. But I like what Dr. Mutuma says over and over again.
Hi people, it seems Mwangi has disappeared. So Dr. There's another question for you. This one goes to Anne, Dr. Anne, the psychologist. My question is directed to Anne. How does one deal with mood disturbance in cancer patients? Anne Wandati.
Okay, thank you for the question. I hope you can hear me.
Yes, we can.
Okay, so when somebody has any form of sickness, not necessarily cancer, but more so when it comes to terminal illness, mood disturbance can be an issue, can be common, because for one, the person is worried and concerned about the sickness, and sometimes also the medication they are taking are likely to affect the mood of the person. And so the the caregiver. The caregiver also needs to go through counseling in order to help to manage the person who is sick, who is unwell. So care of the caregiver also needs care. And then the person who is unwell, when they go for counseling, I remember Dr. Mutuma said last time that the first form of treatment is counseling, so that the patient is taken through everything they are going through, because we normally say that awareness is therapy. Once somebody knows what is going on in their body, what the effect of the medication is going to be, how the disease is going to progress, or how it is progressing. Yeah, I hope I have answered the question.
Yes, Anne, I think you have answered that one. There's another question that goes to Dr. Mutuma. Does hormonal family planning methods play any part in the growth of breast cancer and cervical cancers?
Yes, I think, as I've said, is that actually one of the reasons why we have a lot of breast cancer nowadays all over the world is because of hormones and hormonal imbalances, which is very common in ladies nowadays. And the way I've said is that hormonal pills, mainly progesterone and estrogen, the pills which contain those hormones, actually they pose a risk for cancer cancer of the breast. And that's why you find that actually cancer of the breast, as I've said last time, is that it is common for women who are educated. Okay, cancer of the cervix is opposite. It's common to women who are not educated because of many factors. First, let me elaborate a bit of cancer of the breast. Cancer of the breast is common because it's common in educated ladies, or actually in urban ladies, because of you find that in urban areas we have got few children. The fewer the children you have, the higher the risk you have of developing cancer of the breast. So cancer of the breast, actually, it is directly related to hormonal levels, and the higher levels you have as a woman is actually a risk factor on developing cancer of the breast. And that's why we normally say that women who start having their menarche early and they have got their menopause late, they have got higher chance of also having cancer of the breast because of higher exposure of hormones. So hormonal exposure is a risk factor to cancer of the breast, but not necessarily related to cancer of the cervix. So cancer of the cervix has no any relationship at all with hormones.
Okay, thank you, Dr. I believe that one you have answered well. Let's keep the questions coming. We have Dr. Mutuma, we have Anne Wandati, who is a counseling psychologist. Please keep the questions coming. Another question to Dr. Mutuma. Alice Duncan is asking, feeding is a huge task for cancer patients, especially those undergoing treatment. What foods are recommended?
Mainly cancer diet. The cancer diet is a whole topic by itself, but let me just touch it a bit. But this is mainly covered by nutrition. But mainly for cancer diet, the way I've said, and I'll repeat it again, is that the treatment number 2 of cancer treatment is diet. The first one is counseling. Second one is diet. So what to do with cancer patients? The first thing is that you discourage the patient from taking the food which is a cancer risk the food which is a cancer risk food. And these are mainly refined food. All refined food is not good for patients who have been treated for cancer. First is that we reduce the amount of sugar which the patient takes, because sugar is a cancer feeder, and the cancer likes to feed on sugar. And then you reduce the milk, because milk is also good for people who have got cancer. And then you reduce the red meat. And then you focus mainly on naturals, the food which is natural. The first one, you focus on giving the patient a lot of fruits. Fruits I've said there are mainly 2, pawpaw and avocado, and maybe mango and watermelon. Those are 4 fruits which I normally recommend. The rest are the rest. Don't give a cancer patient banana at all, because banana has got a lot of sugar and it's got a lot of starch, and cancer likes starch and likes sugar. So you give the patient fruits and give the patient a lot of vegetables. And that's why normally I advise patients that you divide your plate into 4 parts. Half of that plate should be fruits and vegetables. Fruits and vegetables are half of that plate. And then the other half should be starch and protein. And when we talk about protein, which you take when you have got cancer, is plant-based protein, not animal-based protein. So you take plant protein, that's beans, cowpeas, pigeon peas, green grams, and all other plant proteins, and you limit animal protein. And the animal which you can take if you have to eat meat is basically a white meat. That's fish and chicken. You don't eat red meat, or you limit eating of the red meat. And then the starch which you should be able to eat when you have got cancer is actually unrefined or raw starch. Raw starch, I mean that you are supposed to eat all grain. Most of our grain is shifted. So you don't eat anything which is shifted. You take actually raw starch or whole grain sort of starch, and that's why we normally recommend that you actually take brown ugali, brown chapati, brown bread, and that's actually what we normally recommend for patients who have got cancer. Now, there's a question which actually I was asked today by a patient who has got cancer. I have got cancer. If I don't take sugar, can I take honey? Honey and sugar. Honey and sugar, which is which? Yes, honey is a bit raw, but remember, honey is still sugar. So there's no, there's people, even I've seen people with diabetes, they don't take sugar, but they take honey, but that's all sugar. It's the only thing that you reduce or you stop taking sugar when you've got cancer. So the diet for patients who've got cancer is actually a diet which is goes back to the traditional type of food we used to eat. Kidari is very good, especially when we eat kidari, the beans, and it's normally very good. Now, it's not the kidari which has been spoiled like motokoi, which actually is also refined. And that's why it's normally very important to make sure that at least all the time when you've got cancer, even to prevent cancer, you focus on vegetables, you focus on fruits, you focus on whole grain, and you focus on less meat, and also we'll focus on plant proteins.
Thank you, Dr. This one I'm asking for a friend. Does that mean that we should take our tea without any form of sugar?
Not necessarily. Remember, sugar is also very important. I'm talking about patients who have got cancer. But if you can take tea without sugar, that's very good. That's because, remember what I said, that actually one of the reasons why we find that we have got so much cancer is because we are taking too much sugar. First, we are taking too much sugar as sugar itself, and then we are taking too much refined food, which are converted into sugar very fast. And we have said that sugar is a cancer feeder. Sugar feeds the cancer cells. They grow well when there's sugar.
Okay, thank you very much, Dr. Mr. Mwangi is back. Mr. Mwangi, karibu sana.
Asante sana. Sorry, these are technical hitches, you know, it's different times and we have just to take it differently. So sorry about that, I was kicked out. I'm seeing Anne is around, if I'm not wrong. Is Anne there? Anne.
Yes, I am.
Anne Wandati is there, okay? So I want us to shift gears, and Anne Wandati is a counseling psychologist, and if you could kindly shoot questions to her, and as you shoot questions, I just want to ask Dr. almost like, not the last question, but almost, so that we can shift gears and shoot questions to our counselor. And the question to you, Dr. is, you know, most men don't, and someone asked, how many times should they check, how often should they check on their breast cancer, Dr.
We're talking about men.
Yes, on men.
On men, I think breast cancer for men is not that common. It's very rare. It's very rare cancer in men. But at least once in a while. Remember, for cancer of the breast for men, you just check your breast, nothing else. Not much test. It's self-examination. You just check your breast. I'm sure most men, they don't know that they've got a breast. But it's always very important for men to at least touch your breast and look at it once in a while, not all the time, because for the ladies, you need to check it almost every month, because that's actually, especially after the age of 30 years, 35 years, or for 5 years, that age, you need to check your breast as frequently as possible as a woman. But as a man, not a major deal, but you can at least do it occasionally. I will not recommend any time for men when should be able to check their breast. Remember, the best way of cancer prevention for the breast, both for men and women, is self-breast examination.
Awesome. Asante sana for that. Want to shift gears and take put Anne to task. And Anne, you did a fantastic job when you were here. Now tell us, Anne, what is the best way? How do you break bad news to family members? How do you do that? You know, many people go to the hospital, they are given the news that they were not expecting, and they have to either tell their families that they have cancer or that they have contracted cancer or COVID-19 in these COVID-19 times, or the other way is you know that one of your family members has, and you are the one to break news to all the other family members. How do you do that?
Okay, thank you, Mwangi, for the question. So breaking bad news, and the bad news could be the news of death. It could be the news of illness. It could be any news. So when it comes to breaking bad news, especially let's say the news of somebody having died, so you prepare the person by asking questions gradual questions. And if it is somebody who is a stranger, let's say you are calling on phone on somebody's behalf, or you have gone to break the news to the family, you are a counselor maybe in a hospital setting or even in a school setting, and maybe a student has lost a parent. So you call them, then you introduce yourself if you are new to them, and then you say you are calling in relation to so and so. And then you tell them if the person has been sick. So you can explain a bit and say, maybe so-and-so has been ailing for a long time. So when was the last time you spoke to the person? And then after that, the person sort of starts preparing that you have some news to tell them. And then you break the news up front and you tell them that the person succumbed to the illness, or the person was not able to go on with the illness anymore, and now they have died. And then use the term death, not passed on, passed away, gone to higher glory. You use the term death because last time I talked about denial when somebody has died. So you use the term death so that somebody can start working through their denial. Even when it is bad news, like in form of terminal illness, the patient needs to know exactly what is happening to them, and the disease, and the progress, the information, and exactly what is expected of them, and what they expect to happen in future. As much as we cannot be 100% sure, it is good to prepare the patient for eventuality.
Ah, awesome. You know, many times we avoid using that term. So-and-so died. We think it's uncouth. So thank you, Anne, for enlightening us. And Rose is saying, Asante Sana, and this is very helpful. And they're saying thank you. And what about, Anne, if, you know, especially men, we get sick and it's very difficult for us to even tell our families that I have this condition and I need help. How can you help us as men in this forum tonight?
Okay. I think a lot of burden has been placed on the man, especially the African man, and always being expected to be the strong person in every situation. So when now the man who is supposed to be the strong person, the pillar in the family, gets sick, it becomes difficult for them to admit. Even when there is bereavement, a man has lost a spouse, has lost a parent, or even a child, instead of grieving, the man knowing that he's supposed to be the pillar will most likely be the one supporting the others, supporting the family. And so it is okay for the man to feel. It is okay for the man to feel. And even it is okay for the man to admit that I am in this level of pain and I need help. So we don't have to place so much burden on the man so that they are not able to seek help.
Okay. Yeah, now I want to talk of caregivers. I want to talk on behalf of caregivers. You know that your family member is unwell. You can see that they have been but they have not asked for help, you know, or you're trying to help, but they're saying, "Me, I'm fine. Don't worry about me," and things like that. How do you go about that? You know, especially when it's let's say husband wife, and the husband wants to still be macho, okay, or it could be that it's a parent who does not want to overburden the children, but then on the side of children, on the side of a spouse who wants to help, but this other person is saying, "Don't worry about me, I'm fine." What do you do about that, Anne?
Yeah, a very common situation, especially with men, and especially when it is the children who are seeing a father is sick. I've handled personally situations in counseling whereby a man was sick for quite some time. The issue we were talking about last time, prostate cancer, and he had not shared at all with the wife, with the children. And for so many days, he would remain in bed the whole of the day. He would remain in bed. He had become very hostile to the family. He didn't want to be asked questions. He didn't want to go to talk about the sickness, until one time, quite by default, the wife had left the home to go and work, and then she came back earlier than expected, only to find him crying in pain. And so now he had to admit that there was something wrong. And all I can say is, now I think we really need a shift in the cultural perspective, that it is okay to ask for help. It is okay to ask for help, even for the man. And so what I would say is, can we psychoeducate those people who are within our circles that it is okay to ask for help if you are in pain? It is okay to tell a spouse. It's okay for a husband to tell a wife, I need to go to hospital. I need to be taken to hospital. And those who are mentoring the young men, the teenagers, okay, we don't want to raise them to be sissies, to be crybabies, but at the same time, when there is need, it is okay to ask for help. And a lot of men end up coming for therapy, sometimes because they had an issue, maybe lost a parent, and then they could not grieve because a man does not cry. And so it ends up becoming even something, a sickness that is not going away, depression, and so on, until they are able to be taken through grief. So what I would say is, psychoeducate the men within our circles, that when it is time to ask for help, it is okay to ask for help. It is okay to say somebody is sick. It is okay to grieve, even when somebody has lost a parent or even any loss. I can imagine the number of men, like right now, around this time when people have lost jobs, and then they have not been in a position to even admit what they are going through. And so it is a good thing to say, today I need help, or I lost my job, or the pain is here and I really need to go and see the doctor.
Awesome, awesome. Thank you, Anne. Anne, Jen Matu is asking, so Anne, what should we not do when handling a patient or anyone else in need of our support? What should we not do?
Okay. Yeah, thank you for the question. one of the things we should not do is not to magnify the illness too much, so that when a person is sick and maybe they are in hospital, but there are things they are able to do for themselves. For example, they are able to feed themselves. They should be allowed to do what they are able to do for themselves, so that we do not take power completely from them. Then the other thing we should not do, even in cases of terminal illness, I've seen this a lot, where maybe it is a parent who is sick and the children and the parent who is well. Let's say it's a father who is sick. The children and maybe the spouse may move the patient from one hospital to the other without telling them precisely why they are taking them. So they talk behind the patient's back, they make decisions, they don't involve the patient. It is very important to involve the patient, because after all, the procedure it's them who will go through the procedure. It is them who are ailing. And sometimes we think people are weak, but when they are given information, they are actually really able to rise to the occasion and even to take charge of the medication, the sickness, the appointments, and so on. So one thing we should not do, bottom line, is not to disempower the patient.
Do not disempower the patient. Jane, do not disempower the patient. The patient needs your support, but do not disempower them. That is amazing. Lastly, Anne, we are in this season that has been difficult for many, many people. And then I just want to also refer to last week, you know, when Dr. Mutuma was sharing with us his story about his battle with COVID-19. One of the things that hit him hard, and he confessed but got help, was depression. And I believe in this time, many, many people are battling depression, maybe sometimes knowingly or unknowingly, because of the harsh conditions, or also just sickness and disease that has hit families. COVID-19, people have lost jobs, people have lost businesses, income has not been forthcoming, and Monday is knocking at the door. And I remember on news, some parents were saying we don't even have school fees, which could be a source of stress, pressure, and then depression. And how do we handle depression?
Yeah, so when it comes to depression, it is usually in stages. And when the depression is mild or moderate, the counselor will handle that and take the client through sessions. When it becomes severe to the point that the patient is not able to wake up or even to take a meal or to take a bath, the best option is to take the person and get them hospitalized. Then when it comes to depression, maybe the main indicators are important, so that we are able to identify depression in ourselves and in others. That if somebody is sad all the time, and for about a minimum of 2 weeks, feeling sad constantly, crying constantly, and then another major one is loss of interest in activities that were previously enjoyed. There is something we all enjoy. Sometimes it's a particular type of food, a particular type of music, a particular people are very passionate. Sometimes it's the work they do. And then if you lose joy totally in an activity that you previously enjoyed, so that music you loved, it doesn't make sense anymore. So that maybe that going for ice cream no longer makes sense. Now that could be a sign of depression. So to handle the depression, a counselor will help you with diagnosis, manage to identify how severe is it. The more severe it is, the more you are likely to be referred to a psychiatrist. If it is mild or moderate, you may not need medication. A counseling psychologist will take you through.
All right. And many at times, most people are battling depression, a lot of stress, but they are not seeking help, especially from counselors. What do you have to say about that?
Yeah, generally there is a fear. There is fear of seeking help, and the fear comes from sort of feeling that you have lost control. And so I would want to say this, that counseling is getting support so as to walk through everyday issues. They actually become overwhelming and you need more resources to cope. You need support to cope. It's better when you go and seek help from a counselor. What the counselor will do is give you support and give you information, psycho-education as you walk through the issue. Sometimes all we need is somebody to walk with us, somebody we can be open to in a very genuine manner, somebody who will be there for you, who will walk with you, and the person, a counselor, will also offer you confidentiality, so that if you come to me for counseling and you tell me exactly what is happening in the family situation, that you are worried about what is going to happen on Monday, and maybe your wife doesn't know that you don't have money for fees and so on, I will not go telling other people. I will treat you in confidentiality so that we can walk through the issue. Sometimes all it takes is awareness, and then somebody is good to go.
Awesome. Thank you so much. And like always, you are amazing. Together with Dr. Geoffrey Mutuma, I want you to kindly type in your contacts. Anne and Dr. Geoffrey Mutuma from the Zambezi Hospital. And Anne, kindly, if you could type your contacts there, because some of us might need to contact you. And I want to read it out loud for everyone to know. All right. And then, ladies and gentlemen, we are coming towards the end of the season 1 of Candid Conversation, but we would want to know which topics would you want covered here. Before you leave, type them out to us. If you don't want to put them publicly, you can type me a message privately on what topics you'd want covered in the next season, season 2. We will take a short break, but before we take a break, I want to let you know that on the 10th, this coming Saturday, on the 10th of October, it will be the World Palliative Day, and we will be marking it right here at the Boot Cancer Challenge. We will be holding the 5th edition of the Outburst Boot Cancer Challenge from 8 o'clock in the morning to 11 a.m. Virtually. Kindly follow us, log in, be part of it. We will be doing a few of the things that we've been talking about. One of them is we will be doing some exercises, we'll be doing some workouts. Number 2, we will be there sipping some water like Dr. Mutuma has told us. We will be there in this virtual meeting, making sure that we hydrate and start learning these things, okay? So we'll be sipping some water, and we will be also, we'll have panelists like Dr. Mutuma and Anne, and a nutritionist, and a cancer survivor, and a caregiver. They'll be talking to us, inspiring us on what they have gone through and how they have overcome. Kindly book a date with us on the 10th of October, this coming Saturday from 8 o'clock all the way to 11 o'clock, and we will be having a ball. I want to also remind you that as you log in, you might just be the person to get the award from Serena Hotel, which will be a getaway for 2 at the Sweetwaters Lodge in Nanyuki. It does not get better than that. If not for anything, then log in, and I promise one of the people who will be on the screen on that day will have a holiday for 2 at the Sweetwaters Lodge in Nanyuki. We want to say asante to all our partners, Safaricom, A to Z Events, Serena Hotels, KEFCA, which is Kenya Hospice and Palliative Association for sponsoring our event and being part of it. Loreto Convent Msomungari, and you for keeping us here and logging in all the time. We want to say asante sana. I want to read Anne's contacts, and Anne's contacts are right here: 0722 227 364. In case you need help from a counselor, reach out to Anne, okay? Her number is 0722 227 364. And if you don't know how to start talking to her, just tell her that, you know, Moas gave me this number, I need help, that's why I have called. And you will start the conversation right there. The numbers to reach Dr. Geoffrey Mutuma of the Zambezi Hospital. It's in Nairobi, South Sea. It's not in Zambezi. It's in Nairobi, South Sea. The numbers are right there on the screen: 0722 801 299, 0722 801 299. The other number is 0734 809 299. So the 801 299 is the same. One is 0722 and the other one is 0734 801 299. If you need more help, kindly reach out to these people. That's why we bring them here so that you can reach out. Ladies and gentlemen, remember, we have been offering all these candid conversations absolutely free. If you did not attend one or two and you need to refresh your memory or something like that, you can go on to our YouTube channel, Outburst Limited, all right? At the YouTube channel, Outburst Limited, and you will get all the 10 episodes there. Pick the one you like, refresh your memory, and just get knowledge. Remember what Dr. said, that the most important thing in the best strategy to fight cancer, and I believe any other disease, is find knowledge, get knowledge. And then, ladies and gentlemen, the other advice I want to give to you is give. And the number to give tonight is till number 750822. The till number to give is 750822. As you give, it comes back to you. And so remember, when you give to this number, you're not giving to Outburst, although it will write Outburst, but all this we are doing for charity, and we will give it to the hospice, the Gio Hospice, because we have committed to support them. And this year, like the past 4 years, COVID or not COVID, we have decided we will go there, we will write them a fat check, and we will give. The number to give is 750822. And then, ladies and gentlemen, lastly, if you want to get in touch with us at Outburst Limited, if you want to get in touch with us, the numbers are right here on the screen. You know, you can call us, email us, WhatsApp us, whatever you want. But most importantly, I want to request that you follow us on Facebook, Twitter, Instagram, and IG. Just follow us kindly. And the way to follow us is Outburst Limited on all of the social media platforms: Facebook, Twitter, Instagram, YouTube, name it. Just go Outburst Limited and you'll find us there. Our numbers are on the screen, 0712 329 320. Kindly get in touch with us, because we are here to enlighten minds, inspire people, and enrich lives. Last but not least, ladies and gentlemen, on Saturday, the place to be should be right here, virtually. Get your t-shirt on, all right? You get your t-shirt on and join us here at Outburst. Get your nice t-shirt. We'll be ready for a workout. Get your t-shirt on, dress sporty. We will be doing some workouts. We'll do some press-ups. We'll do some jumping jacks. We will skip some rope. We'll be having some fun. And then we will get some inspirational speakers right here to encourage all of us. And we are going to have a good time at the Boot Cancer Challenge. It's 5th edition. This is the 5th year we are doing this. And so thank you so much for joining us tonight. This has been your host, Mwangi Chege from Outburst Limited. I want to say asante sana. It's about that time for me to say good night. But before I do that, I want to ask Dr. Mutuma if you have a parting shot. Dr. Mutuma, your parting shot.
Right. Thank you very much. Thank you very much, Monkey. The only thing is that this is a Cancer Awareness Week month. That is October, and what I can tell that is people is that it's good to make sure that at least you go for screening, and there are so many places which can be able to be screened. Ourselves, we normally screen all the time, but of course this month we normally give a discount for screening, and it's good to get actually cancer screening at this time. For the parents and more so for our dads, because of cancer of the prostate, make sure that at least your dad is actually screened for cancer of the prostate. Because what I've seen is that all the cancers, the information is getting to the right people. But for the cancer of the prostate, the guys who are at risk are between 60, 70, 80, and 90. They cannot get information like this. So we need to take care of them. We need to be able to take them for screening, and also we advise them, because I've seen most people who have got cancer of the prostate actually are elderly people who have no way of getting the current information we're getting like here. Asante sana, thank you.
Asante sana, Daktari. Daktari, I'll be coming to visit you soon because of what we have talked about, and I'll come at the hospital because I will not declare my age, but I need to start checking. And your parting shots.
Okay, thank you, Mwangi, even for the opportunity and for having to speak to people about counseling. And this evening, I really want to encourage the participants. Don't allow your problems to become issues that will overwhelm you. Go out, seek counseling. There are many counselors and counseling organizations out there, and we do our counseling very, very professionally. We will take care of your issues, and we will offer you confidence.
All right, ladies and gentlemen, remember, asante sana, and remember to send for us your topics for consideration for the next season. After the Boot Cancer Challenge, we will tell you when we will resume on our candid conversation. So until next time, remember also that we have the Outburst Training Solutions, bringing you team building, and now we are going virtual. So tell a friend to tell a friend. Remember to engage us in your events. Remember also to engage us when you want to book a holiday. We'll be right there to serve you. But most importantly, eat right, do some exercises, go for cancer screening, stay healthy, and keep hope alive. This has been your host, your MC, Mwangi Chege from Outburst Limited. What a night, what a show. God bless you. Have an awesome time. Thank you, Dr. Geoffrey Mutuma. Thank you, Anne. And thank you, you and you for attending the session tonight. God bless you. I can see my DJ is right there, Melvin Kanye. I don't know if he's gonna do something tonight. If not, he will be right here at the Boot Cancer Challenge. Remember, invite your friend, invite your family, invite everyone you can. And I hope that you promise to do that. And let's meet on Saturday, 8 o'clock to 11 o'clock at the Boot Cancer Challenge. God bless you. See you there. Cheers.